Good afternoon and welcome to the latest in our series of career webinars brought to you by the HOP platform. So HOP stands for the Hertfordshire Opportunities Portal. It is a website and a resource that we hope every school in Hertfordshire is using and sharing with students. And we hope it's something you're familiar with and will continue to go back to because it contains a whole host of information that will help you with your next career decision, specifically within Hertfordshire. As you will see, we not only have a website, we have a number of social media handles as well. If I move to my right, I think you'll also see that we've got a TikTok handle as well now, for those of you who know what a TikTok handle is. So do look us up on HOP and do use us. All of these webinars that we've recorded, this I think is the 71st webinar we've recorded since 2020. So there's a whole variety of different subjects that are covered on our HOP webinars. Today we're obviously talking about careers in pharmacy. You may well find that there are a couple of ones that are related to that. So we will talk about the relationship between pharmacy and medicine. We recorded a webinar with a junior doctor from Lister Hospital a couple of years ago. So you'll be able to find all of those on HOP. So have a look at them. Do share them with your family and friends as well. The purpose of these webinars is to give you some first-hand accounts and experiences and insights from experts from today from the world of pharmacy. So very shortly, I'm going to introduce to you Shirley and Chika, and then we will hear from them and their experiences within the industry. This webinar is being recorded. We should be going probably until about 5:30. So if you can't stay with us throughout, it will be recorded. You will be able to watch it back via our YouTube channel on the HOP platform. You have an opportunity today, though, to interact with our panelists. So the way that you do that is you have a questions tab on your dashboard. If you click that, it will open out and you'll get a text box. In that text box, you can type in your question. That comes through. It's only visible to me, and then I will ask that question to Shirley or to Chika. There were plenty of questions that you asked within your registration, actually some really good questions, which we'll incorporate within this webinar today. But if there's anything you want a bit more detailed information about or you want any clarification on, then you will have the opportunity to do that, so through those questions. So you make the most of that opportunity. I would also say just well done to you. So congratulations for coming home from school, for logging into this webinar, because you obviously really want to invest some time and some thought into your career decisions, which are really important. So if you're watching this, particularly if you're watching it live, I really commend you for coming in and logging in. So first of all, I want to introduce our two panelists to you. So Shirley, I'm going to start with you, and it's just a reminder that I didn't actually put on the University of Hertfordshire logo that you asked me to put on there, but you can explain that as part of your job biography now. So Shirley, good afternoon, great to have you on.
Lovely, thanks. Hi everyone. So my name is Shirley. So I am a senior pharmacist. I actually work for 3 different workplaces. It's now what we call a portfolio job. So it's just a job that incorporates being in lots of different areas. So I work part of my time in an acute frailty unit, which is attached to the A&E department at the Princess Alexandra Hospital, but that's in Harlow. So basically a frailty unit is essentially an A&E for older people. So when I'm at Princess Alexandra Hospital, I'm patient facing, embedded into a medical team and making clinical decisions and affecting the treatment of patients when they come through A&E into the Princess Alexandra Hospital, or when they come via ambulances or whatever. Sometimes we go actually onto the ambulances themselves. So that's one part of my job. The second part of my job is working in the same team as Chika at the Hertfordshire and West Essex Integrated Care Board. So an Integrated Care Board is basically an organisation that commissions or buys NHS services. So they look after lots of NHS services. So my role there, a lot of my role there is sort of training and being an expert in frailty and in pharmacy, and in trying to mentor and upskill other pharmacists in dealing with patients that have frailty. So there's a third part of my job, which is working for the University of Hertfordshire. So I work at UH as an academic link pharmacist, which means they employ me to be a person that knows about practice. They run postgraduate courses for pharmacists. So what they need is they need someone that's in practice to give all those dusty old academic pharmacists some flavour of what it is to be a practicing pharmacist in real life. So yeah, that's basically what I do every week.
Thank you. And Shirley, if I can just ask you, just go right back to the start of you, or in fact, before the start of your career, when did you know that you wanted to go into pharmacy? What was your route thinking about when you were leaving education?
Yeah, so I was someone who was good at sciences. So I think you have to have a really strong science background. And I knew I wanted to do something in healthcare, definitely. And I remember going to a careers fair, a careers workshop, and you put in all the things that you like, and out comes a little bit of paper at the end. Probably there's no paper now, is there? It's all electronic probably. That basically correlates what your likes and dislikes on your strengths with the types of careers. And it was things like nursing, dentistry, orthotics, which is like making things for people's legs, midwife, pharmacy, all of those really kind of medical things. So a physiotherapist. So I really had to research into what sorts of things I was interested in. And I think the thing about pharmacy that I really liked was that it was a specialism within a medical arena. So you are, as soon as you start, you're a specialist. And I think another thing that kind of, when I thought about it, I think that the careers in pharmacy are incredibly flexible. So you can do part-time, full-time, you can do lots of different jobs in different areas at odd hours of the time. So it just, in terms of, for me as a woman, it just would enable me to pick up and put down whatever I needed to do and have a career within the wider context of having a fulfilling life. I think what I didn't like about some other careers is that the possibility that the careers would take over your life, and I definitely didn't want to do that. I wanted more to my life than just my job, and pharmacy absolutely enables you to do that.
Sure. Okay. Well, we'll definitely delve into your career routes a little bit further than some of the really interesting things you just said there. Let me also welcome Shikha to the webinar today. So if you'd like to give everyone just a bit of background about your career in pharmacy, Shikha.
Yeah. So hello, everyone. My name's Shikha. So I'm a medicines optimization pharmacist, and I work in East and North Hertfordshire Place for Hertfordshire and West Essex ICB, same as Shirley, and I've worked in primary care for 4.5 years. So within my role, I provide specialist pharmacist services to NHS organisations in Hertfordshire and other identified NHS provider organisations within the area. So I work in partnership with pharmacists and GPs in delivering medicines optimization in practices. So medicines optimization is the safe and effective use of medicines to enable the best possible outcomes for patients. And my role is entailed in working on that area especially. And I provide professional advice and support to healthcare professionals in primary care and other identified NHS organisations when requested. And prior to working in primary care, I worked as a community pharmacist for 15 years. So you may all know that as some of the big retail pharmacies like Boots or Lloyd's, where I carried out various roles involving management, training, line managing and providing services such as vaccinations.
Sure. Okay. And again, same question that I asked Shirley, Shikha. When did you know that this was the career that you wanted to pursue? Thinking back to when you were at school, perhaps.
So I was a keen, passionate about science as well, similar to Shirley. And I within my family, I was surrounded by people in the healthcare professions, and I was very familiar with pharmacy because I had two of my uncles were pharmacists, and they had shops of their own where they used to work. So I was very, very familiar with the profession, and I like the fact of helping patients, working in a team, and I felt really passionate about that. And with pharmacy as a career, as Shirley has said as well, there's so much flexibility within the role, where you can work part-time and full-time and go into different avenues of pharmacy. So you could work 2 days as a pharmacist in community, but also have a role where you can work for the ICB. And as Shirley's mentioned, within her 5-day week, she does 3 different roles. So there's a lot of flexibility to do different things or go into education. And looking at work-life balance with this role, being a woman as well, to fulfill your career, but also fulfill your time with your family as well. And I think it was around when I was choosing my A-levels, I sort of wanted to go down a route where I enjoyed sciences, but also had the flexibility of doing different roles within the career that I'd chosen.
Sure. Okay. Right. So look, really interesting stuff on your own personal career journeys, and again, I'm sure we'll delve into both of those. Well, first of all, Shirley, the question we had just before we came on, and this possibly just a question of semantics, but describe what's the difference between a pharmacist and a chemist? Because I mean, quite often I would say, oh, I've just got to go up to the chemist, but clearly there's a difference between the two of them.
Yes, so if you're talking about the career of a pharmacist and the career of a chemist, they're 2 different things. A pharmacist is a protected title. You can't call yourself a pharmacist if you don't have the right degree. So I think what it is in regular language, we use the 2 terms interchangeably. And I think chemist is just easier to say than pharmacist. But in a community pharmacy, in a community chemist, there won't be any chemists. There will only be pharmacists and pharmacy technicians and pharmacy staff. So they're not the same thing, but you will notice that on the high street that they will call themselves the high street chemist. So yeah. Yes, it is confusing, but in proper language and in proper terminology, they're not the same thing. But I understand that I understand that people will call me a chemist, but I certainly wouldn't be. So a chemist is much more someone that works in a lab, that's kind of manipulating molecules to do whatever they need to do to create new, I don't know, materials or whatever it is. That's certainly not what we do. Certainly not what we do now. We may have come out of that back in the days where we did do lots of compounding and making of drugs, but we've moved much further away from that now. So they're not the same thing, even though in regular language I will quite happily say that I'm a chemist. I'm not a pharmacist.
Sure. Okay. That's good. So thanks for clearing that up. Now, you both, or Shirley in particular, you work in quite a niche area, I would say, of pharmacy. But Shika, could you just give us an explanation about the different strands of pharmacy, and at what point would someone begin to specialise?
I think there are, within the career paths, do you mean, Gareth, of what you can go into?
Yeah, absolutely, yeah.
So, I mean, there are different areas that you could go into. Once you've done your degree, there are different paths you can follow, and you may go into more specialist areas depending on what your interests are. So as Shirley mentioned, there's community pharmacy, which is where you train up and then you do an additional year on top of your degree where you work in a pharmacy for that first year, which you are paid for, and then you become a pharmacist that can work in the community. You can also work in hospitals, and then you work your way up within the hospital, and you can specialise in different areas. Again, similar to what Shirley's done, where she's a specialist in frailty. You can specialise in mental health, diabetes, asthma. You can also follow the path of becoming a pharmacist that works in a GP practice, where you support with the different areas within the practice. You may even specialise in an area i.e. asthma or diabetes, and you at the moment you have to do the independent prescribing course. But Shirley, is it correct, within the next few years within the pharmacy degree you will come out with an independent, you'll be able to prescribe medicines like a doctor once you've completed the degree?
The graduates graduating in 2025, they will all come out being independent prescribers. So when we did the pharmacy degree, we didn't automatically become prescribers. So you need to do a postgraduate qualifications that allowed you to prescribe in all of the areas, just as any doctor would do. So this enables pharmacists at the moment to do things like run their own clinics. So if, like Shika said, if your specialism is asthma and you have a prescribing qualification, then it's very likely that you'll be running asthma clinics within your speciality, and you will be prescribing those drugs and monitoring those patients that have asthma that will come and see you and not a doctor. But in 2025, the independent prescribing will be incorporated within the degree, and all new pharmacists as of 2025 will be prescribers.
Sure. Okay. So just to try and distinguish them between the pharmacists who work in hospitals and say specialists, and those community pharmacists, which, you know, Shika, obviously you said you did for 15 years. And I guess we've got to try and sort of bust this myth that perhaps many people have, that pharmacists are, you know, as glorified shopkeepers. But of course, there will be some of those business acumen and skills that would come into running a community pharmacist, would there?
Yes, I mean, I think, as you said, Gareth, that is a myth. There are many aspects to community pharmacy that pharmacists are involved in now, and I think as the pandemic has shown how much community pharmacists and community pharmacy was of value to patients and to surgeries, because they were the port of call where everybody went to, but they not only provided the medicines for the patients, advice, signposting to where they needed to go. They also do vaccinations, so like the flu vaccination, they got involved with COVID vaccinations. They do different services they support with, and you can work your way up and become a manager within the pharmacy as well, and maybe a regional manager. So there are many paths you can follow within that role as well, if that's the area that interests you and that you wanted to go into.
Yes, I'm always amazed when I go into the local pharmacy because I've got a prescription from the doctor. I mean, there must almost be an infinite number of medications and medicines that are available there, but they've always got what I need. How do they stock so much, or know what to stock and have in there?
I think they have a general stock that they normally keep, depending on the size of the which are the most common medications that most people take. But there may be times where there are medications that patients may request that they may need to order in. But I think most pharmacies have a general stock amount of the most common medications that are prescribed to patients.
Sure. So, I mean, how much of that community pharmacy role is reactionary and dealing with, you know, the customer that walks in through the front door at the time, you know, and how proactive do you need to be as well?
I think there is a lot of normal day-to-day things that you do where you get prescriptions coming in, and now there's a lot of prescriptions that come through electronically, and you have that work to do where they're dispensed and the pharmacist checks those. You get a lot of walk-in patients coming in with prescriptions, but also a lot of advice. I mean, I think the amount of advice pharmacists give now has risen quite high, because from what I hear from other people and from when I was a community pharmacist, was that, you know, we come to you first. You're the first port of call that we come for any advice or help, and most of the time the advice that you give us is beneficial and we don't need to go and see the doctor. So that's really good to be able to help the local community and people around. So there is a lot of reactive things, but there's a lot of planned things like the vaccinations. They also do travel vaccinations that are booked in. So your day can be very varied, but there are certain job roles that you do day to day that happen every day.
Sure. We've had a number of questions that have come in already, so it's great. So if you're watching this live, do get your questions in by that questions tab. There's a couple about GCSEs and university courses, which I'll come on to because we are going to talk about entry routes and subjects very shortly. But this question that's come in, what are the different roles in a pharmacy? So if I go into a pharmacy, Shikha, there's often perhaps 2 or 3 people immediately behind the counter, and I know there's always kind of a mysterious room at the back where someone's working out of as well. So what are the different types of roles, and what's the sort of seniority or the hierarchy within a high street pharmacist?
So the main roles are within the pharmacy. So you've got the pharmacist, you'll have the dispenser or farm technician, as they're called. You'll also have your healthcare staff. I mean, I haven't been to a pharmacy, worked in a pharmacy for quite a few years now, so the names may have changed, but you'll have the healthcare assistant that works on the counter that gives you advice on medication, but they can do further training to become a pharmacy technician. And even higher above that is the accredited technician, where you do all those roles, but you can also check medication off once it's been clinically checked by the pharmacist. So where that second check happens, where a dispenser may have dispensed a medication, you have an accredited technician that can actually double check those medication for the pharmacist, as long as the prescription has been clinically checked by the pharmacist. And you may be a store-based pharmacist, but you could also be a store manager of that store. And as I mentioned before, that can go up to area manager, regional manager, if that is the interest that you have, if you wanted to go within the management path within retail pharmacy.
For sure. And then Shirley, I will come to you. I feel this has been very Shikha heavy in the last couple of minutes. But when you are not dealing with patients, what would you be doing instead? So I suppose that comes to that proactive, reactive.
Within the community pharmacy setting. So when you're not, there's plenty of checking to do by pharmacists when there's been prescriptions that have been dispensed. They would be the main things to do. That is when there isn't anyone coming in for advice, but there's also clinics that they may be holding that may be booked in that we have to take part in, and any support with any day-to-day jobs that are within the pharmacy as well.
Sure. Okay. Look, Shirley, let me come to you then and find out a little bit more of a day in the life of not so much you, because you're in a lead in a senior role now, but perhaps some of you more junior staff within your team. What would they be doing on a day-to-day basis? You said you're based at the Princess Alexandra Hospital in Harlow, and presumably every hospital around the country will have similar facilities. So what are they doing, kind of hour by hour?
Yeah. So in hospital, we are very patient focused. One of the main things that we try and do is basically, essentially, the first thing that we do is we marry up the patient with the drugs that they're supposed to be on. So when people come into A&E, they don't have a list of medicines on them. They don't have their medicines on them. So we basically do investigative work to try and find out from different sources what medicines patients should be on and try and get those prescribed. So one of the things that I would say about medics is that they are very well drilled into how to diagnose what is wrong with the patient. After that diagnosis happens, they might not have a very good idea of what drugs to use to treat that diagnosis. And that is where pharmacists come in, especially within a hospital setting. So there are technical things that pharmacists will do. We call it medicines reconciliation. So essentially, trying to make sure that the patient that's in front of you that's come into hospital that has been very unwell and doesn't probably know what medicines they take, because they're probably on about 10, that we find out what medicines they should be on. okay, but we then don't blindly get the doctors, or we don't blindly prescribe them. We then need to make sure that the list of medicines that they were on are suitable for that patient. So we look at a number of patient parameters, including things like blood results, so all sorts of blood tests, urine analysis. We look at things like blood pressure, all of those things, renal function, to understand whether or not those drugs are suitable to be taken in those patients. So we advise our medical colleagues, and we work in tandem with them to make sure that the drug treatment for the patients that appear in our hospitals is timely and it's also safe. Because quite often, and my experience is that doctors will prescribe things, not really prescribing that in the context of the patient that they see in front of them. So they might look in a book, which we call the BNF, which is basically a little Bible of which has got all of the drugs that we use in the UK in. So they'll read that out and they will prescribe that and not think about the fact that the dose needs to be changed because the person's in renal failure. So in terms of our junior pharmacists, they spend a lot of their time on the wards correcting prescribing, making sure that the prescribing that is done by our prescriber colleagues is safe. So we look at a lot of blood tests and all sorts of different things to enable us to do that. So my junior colleagues will spend most of their time doing that. So we also do have an inpatient pharmacy where there is checking and dispensing. So this is the place where if we need any medicines for our ward, for the patients that are on our wards, in addition to the stock holding that is kept on the ward, we will order that medicine and that will be sent up from our inpatient pharmacy. So in addition to the inpatient orders that come, all prescriptions to go home, which we call TTAs, which means to take away, sounds like a takeout, doesn't it? All of those items to get ready to go home also go through that inpatient pharmacy, and anyone that comes to an outpatient clinic that is prescribed anything, if they see someone just in a clinic, all of the medicines also go through that pharmacy. So it's like a lot of traffic of items with, you know, I mean, in common with community pharmacies, we're talking about doing hundreds and hundreds of items every day. But amongst that technical aspects of providing the drug, there's also a lot of checking of safety, because I think people would be shocked to know that our medical colleagues learn little to nothing around the therapeutics that are needed to treat the diagnoses of these patients.
Sure, so that's where they lean on you, and that's why you guys are such an
we lean on each other, because we can't do our jobs very well unless we know what a diagnosis is, and that's their job, and they're very good at doing that. You know, taking blood, I don't know, palpating things. We do that as part of our independent prescribing course, but that's their bread and butter. So that's what they do. Whereas looking at the therapeutics of things in terms of drug treatment, that's our bread and butter. So we absolutely do things. So within the hospital environment, so me and my team, we're embedded in a clinical team. We sit with them all day, right next to them. We go on the ward rounds. We have as much input as any of the medics, and it's all back and forth in terms of working in a multidisciplinary way so that we can do the best for our patients and make sure that they're safe, and then make sure that whatever they have wrong with them is treated in the right way.
Sure. Okay. Well, look, I want to come on to entry routes into the industry now, because I know there's a lot of questions that come in about that already. So let's just start from the top. Shikha, what are the mandatory subjects that somebody should have if they want to become a pharmacist?
So the qualifications that are needed, so if we just start from GCSE, so I think they need to have English, maths and chemistry, and at least one of the other sciences. So I think double science is what they call it now. I know there's triple science offered, but I think you need to have at least one of the other science subjects, and I think it's 5 GCSEs at least. They were A to C, but I know it's a different system now with the numbers. And then at A level, preferably A to B grade, chemistry plus 2 other of the sort of math sciencey subjects. So biology, maths or physics. I actually did maths, chemistry and computer science, but it is best to check with the university that you're thinking of applying to see what their recommended qualifications they request are for the actual pharmacy degree.
Yeah, okay, so that's very clear cut there. I mean, clearly focus on your sciences here is the message. You mentioned English there, and I just want to, because this is often a question we get asked, on a sort of a functional day-to-day level, what are the sorts of English language skills that a pharmacist needs? So what is the relevance of English to a career in pharmacy?
Shirley, did you want to answer that?
Well, the role of the pharmacist is much more consultation based now. Okay, so you have to have a really good grasp of the English language to enable you to do your job, because you are explaining this is what pharmacists do, and I think better than doctors do it. I know I'm blowing my own trumpet here, but I honestly do think this. Explaining very complex medical technical terminology and conveying it in a language that is understandable to someone that has no medical background. Okay, so you need a really good grasp of English language to be able to do that. And just the really simple things around basic communication between you and your patients and you and your colleagues, English is really important. It's really important.
Thank you. That's a very emphatic answer and a very good one as well, Shirley. Shika, you mentioned about university. You said something that was really key, actually, and we kind of say this every week on here, is that every university is likely to have a slightly different entry requirements for it, and of course the courses will be different as well. So there's a question here about which course should I study, and I don't know, there's probably sort of an umbrella term of a pharmacy degree, but within that there'll be different types that will have slightly different syllabus and different ways of covering it. What would you be looking for? Now, if you were 18 again in year 13 and you were looking for a university course, what would be the sorts of things that you would now be looking for?
I think, from what I am aware of, that there are the standard pharmacy degrees, but there may be some modules more heavily focused other aspects, but I think you can choose that when you go into it. I think for me, if I was looking now at a pharmacy degree, the location where I'd be able to go, the different types of experience that I can do within the course, because I think that's important, where if you can experience different areas of pharmacy within that course, because that allows you to see what path you may want to follow and go into. I think with it being also areas of interest that I may enjoy, so whether there be more aspects of certain areas into the pharmacy practice side, where you can be more involved in academia side as well. So I think there is a basic core degree, but I think Shirley may know more, there might be more aspects where you can, more choice of what other options you can go into.
Yeah, so the basic course is actually not set by the universities, it's actually set by our professional body, which is the GPHC, the General Pharmaceutical Council. They essentially set the syllabus. They basically say, the pharmacists that we want qualifying, we want them to know X, Y, and Z. So within that, how much or how little you do, there's wiggle room for that. And so there are certain universities that may well be known for being very heavily, I don't know, hospital based, or very heavily pharmaceutical based. So you're much more likely to then go into a career working in industry, trying to find the cure for cancer. Others will have you know, lots of research around pharmacognosy, which is basically the science of extracting drug entity molecules from plants, for example. So each university has its area of interest in terms of its research, and actually you will get a feel for that when you look at their websites and look at where they've published in terms of research. I think one of the things that I was going to have to say is that be careful if you want to apply for pharmacy, apply for pharmacy. Don't apply for pharmaceutical sciences, because that actually isn't the same thing. Make sure that what you're applying for means that you will be a pharmacist at the end of the day, because if you apply for pharmaceutical sciences, you're not going to be a pharmacist at the end of the day. So just be careful. Pharmacy is definitely pharmacy, but if there are pharmacy is something entirely different.
For sure. Okay, well, that's a really good point you make. But there was a question that came in, which was, would you have to study pharmacy, or, for example, could you go in by studying biochemistry, as an example?
Yeah, you would be a biochemist after you studied biochemistry. You wouldn't be a pharmacist.
Sure. Okay, so very good. So have a look at the actual pharmacy course,
Yeah,
and
yeah.
not a cousin of pharmacy. Have a look at pharmacy specifically. Okay. Is the only way to become an accredited pharmacist to do a master's pharmacy degree? So what point do you get that accreditation? I guess, or a license? How does it work when you come through your postgraduate?
Yeah, so it's basically a registration. It's a registration. You have to appear on the register that's held by our governing body, the GPHC. So essentially what you need to do is you need to do some kind of undergraduate course. So that used to be a Bachelor of Pharmacy, and now it's a Master's of Pharmacy. It's 4 years, and that includes some research within that 4 years that you're undertaking. And actually increasingly it will be increasingly structured like a medical undergraduate degree, where there will be lengthy placements so that you get a lot of patient-facing work. So it's not all dry science. That's the foundation, but actually very quickly you move on to patient-facing therapeutics and things like that, physiology, you know, so you may well do biochemistry as part of your undergraduate course, but it then is incorporated very quickly in terms of therapeutics, like what you actually do with that biochemistry to make the drugs and, you know, monitor the drugs in patients. So yes, the only way of being a pharmacist is undertaking a master's in pharmacy. So then you've got your degree, but you're still not a pharmacist, because then you have to do 1 year in practice, which is called the foundation year. So you are a trainee pharmacist, where you basically do training in practice. So that will be in a patient-facing role, in whatever, you know, it could be in a GP practice, in a community pharmacy, it could be in hospital background, hospital placement. You have to produce a portfolio. You have to hit competencies that you have to pass to the minimum standard of our governing body for your tutor to sign you off. You have to sit the registration exam and pass the registration exam. Then you qualify as a pharmacist. So it's very rigorous. And the exam is 3 strikes and you're out.
Okay, so
if you fail 3 times, you then can't become a pharmacist.
Sure. Okay. Well, so I mean, excuse the pun, which, to be fair, I've had prepared for a few weeks. If truth be told, it is a very prescriptive route into becoming a pharmacist.
Yes. Well done.
Yeah, thank you. So a couple more questions. I mean, this one I think links into what we've just been talking about. Is being a pharmacist very chemistry based? I mean, surely we spoke about that before we came on live, didn't we? The relationship between pharmacy and chemistry.
It is, in terms of for what you study. So I would say probably, so you definitely need chemistry as an A level. That's a good grade. I would probably say the first couple of years of the degree are probably quite chemistry focused within a patient kind of context, but very quickly it it starts becoming about consultations and about the psychology of patients and psychology of, you know, of what health beliefs and, you know, all of these things, and what drugs do you use in what disease states and what is the outcome that you want to produce. So it's the foundation, but I certainly don't do inorganic chemistry at all during my professional life, at
Okay.
all. But it's there within the therapeutics that we use to treat our patients. So when you
Yeah.
qualify, you're not talking about, I don't know, covalent bonds or whatever in chemistry. Just trying to remember my chemistry now. But you absolutely need it for the first part of your degree.
Yeah, okay, I understand. Shika, there's a subject-related question here. Are there any limitations of not taking A-level maths, or would the basic GCSE skills be enough?
You don't have to take A-level maths to do the pharmacy degree, as far as I'm aware. I mean, as I said, you may have to look at the specific requirements. I know the sciences are preferable, chemistry obviously being essential. So if you've just done it at GCSE, but you choose the sciences, as far as I'm aware, that should be fine. But you need to, I think, you need to have the GCSEs at certain grades for you to continue with the pharmacy degree. But no, maths, I don't think it's one of those type of subjects, but you don't need to have maths for it, because I know colleagues of mine that have done chemistry, biology and physics. So it really depends on the requirements of the actual university. They are very similar, but there may be differences in their specific requirements.
Yeah, so again, just
Yes,
have a look at those.
I was going to say, in our normal everyday life, we don't do algebra, okay? But I certainly calculate infusion rates pretty much, I don't know, 2 or 3 times a week. I calculate doses based on weight, I calculate doses every day. So you need good basic math. You don't necessarily need algebra.
Sure. Yeah. No. Okay. No, that makes sense. Does it matter which university you go to for pharmacy? Is one thought of better than any others? Now, I mean, it's interesting, Shirley, you said that the syllabus is actually written. It's not written by the universities. It's written by the council. But are there some universities that maybe would carry more weight?
So, not really. They all have their different focuses. So, and they are all taught slightly differently. So some of the graduates from some degrees, some universities will present themselves slightly differently, or they have strengths in different areas because they have got a better grounding in particular places. But I work with 50 pharmacists. I've got no idea where they all come from.
Sure,
So it
yeah.
really makes no difference.
Yeah. Okay. Now, so this is thinking about trying to get into university, and I'm sure it's a question that you guys get asked a lot when you go to the careers fairs. But what would be the best way to go about writing a personal statement for, well, say it's for medicine or pharmacy, but you guys obviously focus on pharmacy. So, what would you recommend someone puts in that personal statement in that UCAS application that's going to help get them to the front of the line when universities are looking at who they're going to take onto their courses?
That is a very good question.
Yes.
I think it depends on what the universities are looking for. So some universities want people to be very academic, so therefore you need to demonstrate that you have a very strong academic side to you. Other universities will not be looking for that, but be looking for someone with the ability to be able to communicate well with patients. So they will want demonstrable evidence that you have a range of different ways of communicating with people. So it's actually very difficult to say because I think that different universities want slightly different things. But I think the key is a strong science background and demonstrating that you have a really good, strong grasp of those basic sciences, but have a people-facing outlook.
Yeah.
Because we don't work in labs. Some of us do. Actually, some of us do. Some of us work in GlaxoSmithKline or whatever, and they do work in labs. But even when you work in a lab, you're working within a team, and it's about teamwork, and it's about that kind of communication skills. So I think it's about demonstrating that you can work well in a team and that you've got patient safety in mind. So it's really about marrying the science with the more kind of practical aspects of what a pharmacist might be doing within their career.
For sure.
But saying that, they're all going to look for something slightly different.
Yeah.
I think I agree with Shirley on all those aspects. Each university will be looking for something in particular, but taking those two factors into consideration and marrying them up together is a good way to write your personal statement. I mean, it has been a while for both of us, so I'm sure things have changed a lot, haven't they, Shirley?
I'm sure all of you that are watching this, you will have teachers at school who understand, personal statements and will be able to give you a lot of guidance around that. But I think, what Shirley and Shika said there is really important. It's combining that knowledge and passion for science, but also demonstrating that understanding of working with people and actually dealing with patients, because that's what you're going to be doing. Question here: for most universities, they ask for AAB. Would they therefore expect an A in chemistry? I mean, I don't know whether you can answer that, Shika, without looking at the individual universities ones, but it's not going to do you any harm, is it?
I think you would need to check the entry requirements for that specific university on what it may be AAB of the 3 A levels that they have. But yes, I think you would need to, wherever you're interested, have a look at the specifications, because some of the universities are very specific on the grading and requirements they would like for you to do the degree.
Yeah, okay. Right, next question. I can answer a little bit of it, but I think I'm going to need you guys just to connect my answer here. So the question is, can you become a pharmacist through an apprenticeship? Now, obviously, we were hoping that we were going to get one of your colleagues on today who specialise in that area, and there are some links that we will share with you. So my understanding from the notes that were provided to me was there are some level 2 apprenticeship courses that are available to become a pre-registration trainee pharmacy technician, a pharmacy support worker, or a science manufacturing technician apprentice, which are generally you can access after GCSEs with English, maths and chemistry or science grades at grade 4 or above. We will share the link to you. Now, I'm guessing that by going on, that's actually a really good way of getting onto of understanding the industry quite well. And I'm guessing once you get to that point and you get through the other side of your apprenticeship, you've then got opportunities to then go on and then perhaps go through that more academic degree route, that prescription route that we've spoken to. Is that the case? But
yeah, that's right. So actually, so pharmacy technicians are actually a career in their own right. So I'm a pharmacist. I cannot be a pharmacy technician. It is a totally different career route. So if I wanted then to be a pharmacy technician, I would need to go back and I would need to do an NVQ level 3. And then I would need to train as a pre-registration pharmacy technician to then be a pharm tech, essentially. So the 2 careers used to be very much closer together, but they've actually, now what's happened is that pharmacy has split into a technical side, which is much more to do with pharmacy technicians, and some more what we would call a clinical side. But it's like, okay, are the drugs appropriate to give to these patients? Are we being safe, or are we going to kill this patient by giving them the wrong drug? So a technician is much more around technically checking that we're technically giving the right thing to the person, but there needs to be some clinical judgment, which is what pharmacists do, to ensure that we've made the right decision before we supply the drug. So the careers are split and they are different. And actually, we're sort of two halves of the same whole. We couldn't do our jobs without pharmacy technicians, and pharmacy technicians can't do their job without pharmacists. So we're kind of, each other's right-hand man, basically. But they are different. At the moment, you cannot go through an apprenticeship route to become a pharmacist. You can have other careers in other pharmacy roles by doing apprenticeships. That it has been mooted professionally whether or not there might be a apprenticeship route, but it would be level 7. I don't actually know if there are such things as level 7 apprenticeships, but that's what it would be.
Sure.
So
Okay.
Highest level of apprenticeship to be able to do to be a pharmacist. So that is still out to consultation, I think. So we are thinking about it, but at the moment, no, you have to do pharm.
Yeah. No, okay. No, thanks for answering. So yes is the answer to the question. There are apprenticeship routes that will get you into sort of the pharmacy industry, but not to become a pharmacist specifically. But that may well be a good route for you to go into. So I will share some links before we close the webinar where you can find out a little bit more about those. A couple of questions about work experience. So what are the best ways to gain work experience for pharmacy? So again, I'm sure this is a question, Shika, you get asked a lot by young people. How do they gain work experience, and what are the sort of responses that you'd want to give?
So I don't know how things are now within schools, but from what I hear, there used to be where the schools support with work experience in different professions and areas. But I think it's really useful for you, if it's a career that you want to follow, to try and get some work experience within the different areas of pharmacy. For example, working in a community pharmacy, if that's what interested to you. I started off doing a Saturday job initially, and then from there found that I really liked the career in community pharmacy, which is what the path I followed. You can also gain experience maybe in industry, in hospital, and maybe even academia, if that's something that you're interested in, which I'm sure Shirley may know more about. But I know secondary schools have some support to do that. I know within COVID that wasn't possible, and a lot of places then didn't restart the work experience, but that would be the path I would look at within and even your own self, maybe getting like a weekend job or something within the area, which is more, I think, for retail pharmacy. I don't know about hospital if that's possible, in seeing what the job involves, and you gain a very good insight into that role if you are doing it as a part-time job as well.
Sure, yeah. I mean, you must just be exposed to all sorts of fascinating conversations, wouldn't you? Even if you're just a retail assistant, but you're talking about those part-time roles where you're working behind the counter there. That's gonna, you're going to pick up good things from doing that. A couple more questions, well, a few more questions actually. Kind of 3 in a row here, all that relate to pay, which, like, I suppose we don't want to say should be the driving force in any career choice, but it is an important factor to consider. So, what's the maximum pay you could get in pharmacy, and how long does it take to reach that highest band of pharmacy?
I'll talk from an NHS perspective. NHS perspective is different from retail perspective. If you are an independent pharmacy business, absolutely the sky's the limit. The sky's the limit. If you have good business acumen and you are good at, I don't know, sourcing good quality stock for low prices, if you're good at selling other non-pharmacy related products like perfumes and all sorts of stuff, then there's no limit. But if I talk about, and maybe Shika can probably, expand on that a little bit, but from my perspective, in terms of pharmacists within the NHS, we're the second highest paid profession up against doctors. And I think the doctors are only really that high because the consultant pay skews that data, because certainly junior doctors don't really get paid that much at all, and they work very long hours and terrible rotas. So we are very highly paid within NHS. I would say we're one or two bandings within Agenda for Change, which you would probably need to go and have a look at that, one or two bandings higher, because our expertise in drug knowledge is recognised, and so that immediately makes us a higher banding. So for instance, a trainee pharmacist who is not qualified is a band 5. That is the equivalent to a very experienced nurse who's already been qualified. So for pharmacists, they're not even qualified and they're a band 5.
Sure, okay, that's some good relativity there. And then, does doing a PhD in pharmacy make a difference to, I'm going to quote, just having a master's? Is that how the bands are worked out? Is it based on qualification?
No. It's based on your ability to do the job. So you can go and do a PhD. If you want to go into academia, then it probably is highly likely that you should go and do a PhD, because that will help you in terms of your research methodology and your knowledge around academia. But in terms of working within a patient-facing arena, it makes no difference.
Sure, okay. Shika, a question here for you. Are there any jobs that you know of that include a fair bit of travelling? I'm going to guess that's within the pharmacy family here. Last week we did a career on air cabin crew, which if you want to go and travel, that's a great career. But within pharmacy, what are the opportunities like to travel? Are you, as I say, stuck to one hospital or to one site?
No, I think there are there's opportunities in various different places, but sometimes some of the careers, depending on what they are, you could be asked to relocate to an area where there is a need for community pharmacists, let's say, or a practice in a rural area that not many people work in. So there could be opportunities for you to travel to those areas. I know I've heard of opportunities in rural areas where they allow you to relocate. They'll fund you for going there. But abroad, it may be more industry-wide opportunities to go abroad, I would say. Wouldn't you say, Shirley? Like some of the big pharmaceutical companies like Glaxo or Pfizer, where you are working for a pharmaceutical company, you may have opportunities to travel with your job with them, or even get a job with one of their sites in another country. That could be a possibility as well.
Sure. Okay. Yeah. So it's a good answer. I mean, that's actually a good segue to sort of the final couple of questions I'm going to ask you, because we're approaching 5:30 here, and that's just the prospects for it. And it's just to try and sell pharmacy as an industry where there's going to be huge demand for, so I guess specifically within Hertfordshire. So, Shirley, can you just give everyone that reassurance that 10, 15 years down the line, there's still going to be demand for trained pharmacists within the county?
Is the massive demand, because the government keep finding new roles for pharmacists. So they're always emerging new roles for pharmacists that 5 years ago people didn't really work in GP practices, not really in the numbers that they do now, and people have gone in droves to GP practices and what we call PCNs, which are like collections of GP practices. So we're absolutely crying out for pharmacy staff. We can't find enough. We can't find enough. It's actually now appearing on the government's professions in need list. So therefore we are welcoming pharmacists from overseas to fill some of those gaps, because we really are lacking in suitably qualified pharmacy staff. I don't think that's going to change in the next 10, 20 years. I just think that the roles and responsibilities of pharmacists will keep expanding and keep changing. And I think that once we have a large majority of pharmacy individuals that have prescribing qualifications, that role can only get bigger. So I think in the future, people will be going to see their pharmacists, not their doctors.
Sure. Okay. Well, yeah. I mean, I know from personal experience that it's something that I'm do now. I know if I can't get a doctor's appointment, I can go to the pharmacist, and often they can give me some really good advice and help out. Just a question. I mean, once you so qualify, for lack of a better word, who is it you're likely to be employed by as a pharmacist? Is it going to be the NHS? Is it going to be Boots or the High Street pharmacy? Or you mentioned GSK. We've also got Roche within Hertfordshire. Who are you likely to go and be employed by?
I think that depends on your route, on what you sort of decide at the end, because I think there are opportunities in all of those areas, isn't there, Shirley, for you to be employed by?
Yeah.
I think there is massive demand for pharmacies at the moment in community and hospital, isn't there? Because a lot of people have gone into the GP practices, but I think it's where your passion is and what area you'd like to go into, but there may be more competition for some aspects of the areas than others.
Oh, okay. No, thank
well,
you. Good answer. Go on, Shirley.
No, it's fine. I agree. We just need more pharmacy staff, so absolutely encourage people to do the degree and go on that career path.
Yeah, okay. So you're hearing that loud and clear from our experts. You picked a good career. On your screen at the moment, there's some QR codes there for various websites. So the ones on the far right, so the Health Education England, that will give you a bit more information generally about apprenticeships that are available through the NHS, which will include some of the ones that we've referenced earlier. So if you're interested in apprenticeship routes, specifically go and have a look at that one. Likewise, the pharmacy chemistry one you got above that one. The one smack bang in the middle, NHS careers, I mean, that is kind of the go-to place for any careers that I think it's over 350, aren't there, different careers that the NHS needs, of which, say, pharmacy is, of course, one of them. But that's a really good website to reference. And then you've got your industry-specific ones that are listed on the left-hand side. So, Shika, if I could ask you just to explain those two websites and those two organisations, and then Shirley, I'm going to ask you to answer the question, but I'll give you a bit of time to think about it. That's just come in, which is, do you have any book recommendations for sixth form students relating to pharmacy? So have a think about that. To have a look what's on your shelf at the moment. But Shika, if you just want to explain the two societies that are listed there on the page.
So the Royal Pharmaceutical Society, if you go onto that website, that gives you lots of information about careers, pharmacy as a whole, the expectations, and lots of information about pharmacy and different pharmacy degree pathways. The General Pharmaceutical Council is the regulation council for pharmacists, and that is where, as Shirley was saying, they're the ones that go through what the expectations are for our when we do our university courses, the regulations we follow, and where we have to log our CPD. So there's lots of information on there on careers as well. So they are good sites to look at if you want more information on pharmacy, especially different paths that you want to follow as well on the Royal Pharmaceutical Society.
Sure, thank you. And then, yeah, so Shirley, any book recommendations? And Shika, if you've got any as well, then do let us know too.
In terms of books, there are not very many that I would recommend, but the information on the GPHC website and on the RPS website is incredibly helpful. So it really, just exactly what she said, it gives you a real flavour of what is involved in people's day-to-day and what people do. So I don't think you need to read tomes and tomes and tomes to be able to get a good flavour of what it is that you'll be doing as a qualified pharmacist. And because the careers are so varied, I think what you need to do is just be aware that that variety is out there and just have a look to see what sorts of things people can get involved in, because I think you would be surprised that you can do, I don't know, veterinary medicine, the veterinary pharmacy, or you could be a pharmacist in a prison. All sorts of wonderful things. And the GPHC and the RPS have got some really interesting stories around sort of case studies of pharmacists to go and read.
Yeah, for sure. Okay, well, look, we've gone over 5:30. I did want to ask all the questions that came in because there've been some such good questions and you've been giving us such incredible answers as well. So, I mean, just in closing, I've saved this question for the very end. I'm going to elaborate on it a little bit, which is, would you recommend pharmacy as a career for younger people and why? So, Shika, I'm going to let you go first again, and then Shirley, any closing
yes.
thoughts you have?
Yes, I would recommend it as a career for young people. There are so many opportunities available in pharmacy now, so many career paths you can follow, and I think it would cater for so many different people and interests in the areas that you can go into. So I definitely recommend it as a career.
Sure. And then Shirley, final word from you.
I'm going to be really blunt, and I'm going to say absolutely yes, because you'll do a degree. Your degree will train you in the job that you will do. And after you've done your degree, you'll get a job. And not only will you get a job, you'll get a good job and you can make a career out of it. So yeah, definitely.
There you go. A ringing endorsement from both of our panelists today. Just in closing for everyone, just want to remind you again, if you're not familiar with it yet, do have a look at our HOP website, have a look at our social media handles as well. The QR code in your screen there will take you to our virtual encounters page, which is where this video will be available from tomorrow morning. And you'll see all the previous webinars that we've done as well. So we did one with a junior doctor, I think maybe 3 years ago now. So if you perhaps want to compare and contrast, if you're in two minds about whether you want to go down the pharmacy route or the medical route, then have a look at that. But there'll be something in there for everyone. So all your friends at school, there'll be a webinar on there which will be of interest to. So please do have a look at that. I'd like to thank all of you that have come, particularly those of you that came home from school and you've logged in and joined in this webinar, sent in some really, really thoughtful questions. I really hope we've been able to answer those for you today. But more particularly, I want to thank our fabulous panelists, Shirley and Tashika, for giving up their time, not just for this actual hour, but in preparation for it as well. You've shared some fantastic insights with everyone today. So Shirley and Tashika, thank you so much for inspiring our future pharmacists within
Thank you,
HOP.
Garen.
Thank you. So look, we just wish you all the best if you're in year 11 or 13 about to do your exams. Very best of luck with those. And we hope that many of you watching this today will be our pharmacists of the future. So whether that's in one of our hospitals or whether those are in one of our high street pharmacies, we hope to see you very, very soon, and best of luck. So thank you and have a very good evening.